Good morning. We will now begin the 11:30 public briefing on the COVID-19 novel coronavirus. I'm Brian Beam, Calcasieu Parish Administrator for the Police Jury, and we've got a lot of important information today, as we do each day in these updates. We will actually begin today with Dr. Lacey Cavanaugh from Office of Public Health. If there's any updates from Dick Grimion, OEP Director, we'll insert those later, but this time we want to get to her first.
Hi, good morning. We do have a very important update this morning, and that is that although you do not see it on the map behind me yet on the LDH website, we do have our first confirmed positive COVID-19 case in Southwest Louisiana in Calcasieu Parish. I would like to make sure that everyone knows that that person has been contacted, is isolated, and we will be speaking about making sure that any close contacts of that individual are appropriately isolated and worked up. So that is the major update. At this point in time, we are not able to release information about where that person is receiving care or any other demographic information about the positive case. So that is the major update since yesterday. So now more than ever, it is extremely important to continue socially distancing, as we have been talking about for a couple of weeks now, to make sure that we are washing hands and that people are actually taking this virus seriously. So that's all that I have for today. I will like to ask Liz Harmon to come up to speak on behalf of any updates on the hospital side.
Good morning. I just wanted to say that the governor has been very diligent in making sure that he's aware of the available hospital beds and of our ventilator capacity. Additionally, yesterday afternoon, the Louisiana Department of Health issued a directive that all medical and surgical procedures that, in the medical opinion and judgment of the physician or other appropriate healthcare professional acting within his scope, that can be safely postponed, shall be for 30 days. So that makes a big change in how we're going to be doing business for the next 30 days. So if you're contacted, please be patient. This is your physician's call, and that's how that will go. Thank you.
And I'd also just like to mention that the case will be updated on the map at the 5:30 update. So.
They may want to ask questions.
Sure.
Can you tell us whether
Can we get the microphone?
Oh, sure, I'm sorry. Could you tell us whether the first case is hospitalized and perhaps the sex or the age of the person?
We cannot release any of that information at this point in time.
Okay, thank you.
Oh, another thing I would like to point out is that the state lab, obviously we get those positives immediately. For the private lab testing side, so if a test was sent off, say through Quest or through one of those sort of mechanisms like LabCorp, those companies have 24 hours per the sanitary code to report that case. So sometimes there could be a delay from the time that that individual who has it gets that positive back and it actually makes it to the state level and onto the map. So there is sort of a 24-hour window by which, by law, that private labs have to report cases that are positive.
Next, we will ask the Executive Director of United Way, who is the official agency hosting the 211 service, for an update. Denise Durrell.
Good afternoon. We just want to continue to remind the general public that if you have any non-emergency questions related to the virus, to please continue to call 211. As of this morning, we have actually answered 9,124 calls. In addition to that, almost 20,000 individuals have texted through a device to receive information related to us. I do want you to also understand that if you ask a question and it's a first time, and what we'll do is we'll go to the Department of Health to get to the correct answer. And we did have an example 2 days ago. We had a supervisor from an offshore rig who had someone who was symptomatic, and of course they weren't able to test, and they called 211 to say, should we isolate this person there or should they be brought inshore? And the Department of Health actually made that decision. So we're answering those questions in real time. So that company was automatically able to make the right decision to move that person, depending on what the Department of Health decided that they needed to do. So we just want to remind everybody, and also to be patient. If you call the number with the influx of additional phone calls that we're getting just yesterday, it was 2,000 calls. There may be some hold time, so please just be patient with us. We're doing the best that we can, and again, we're trying to service the general public in any way that we possibly can. So thank you very much.
Okay, next we're going to hear from a few members of the Executive Policy Group. The first will be Calcasieu Police Jury President Tony Guillory.
Thank you, Brian. I'm Tony Guillory, Calcasieu Parish Police Jury President, and we have been, we've been closely watching this progress of this virus and have been preparing for this along with lead health officials and elected officials. The measures taken by the President and the Governor are proven ways to reduce the spread of the virus, and we suggest that people follow these measures. Please continue to follow the guidelines of our health professionals. Do not have large gatherings. Some of you stay home if you are sick. Practice social distancing. Wash your hands regular. We will get through these tough times and will continue to work hard to ensure that the health and safety of the people of Calcasieu Parish at the best that we can do. Thank you.
Thank you, President Guillory. Next will be Mayor Hunter of Lake Charles.
Thank you, Brian. Good morning, everyone. Obviously, the news that we just heard was some sobering news, but I want people to know that we've been preparing for this. While we certainly were hoping that this announcement would not come, quite frankly, it's not unexpected or a surprise that we would eventually have a positive test here in Calcasieu. That's just simply mathematics and science. Now is the time, just as always throughout this, but now is the time to continue to stay calm, stay vigilant, and listen to the advice of local, state, and federal elected officials. Many of the steps that we have taken locally were designed to prevent the rapid community spread, and I am very thankful that we took those steps. Local leadership continues to work together with teamwork and cooperation. And again, by pulling together, we will get through this. Thank you.
Thank you, Mayor Hunter. Before our next speaker, I meant to say this earlier, beginning tomorrow, we are going to hold these daily briefings at 2 p.m. simply because the current time is conflicting a bit with some federal announcements, and there's also other meetings. So beginning tomorrow, 2 p.m., same place here, and then unless it changes again, that will be the daily schedule, 2 p.m. each day. This time, I'm going to ask Sheriff Tony Mancuso to come to the podium.
Basically the same information as yesterday. Things have been relatively quiet and calm as a standpoint, as from a law enforcement standpoint. I do want to, again, we keep getting calls and saying, hey, the National Guard's coming in. We hear you're going to self-quarantine, make everybody quarantine in their homes. I'm going to tell you that we are not getting any of that type of information. The National Guard, if they come in and they're needed, it's going to be on a medical basis needed, and that would be a call from OEP and our medical community that would request that. So that would not be that would not be abnormal. But at this time, they're not coming in to quarantine everybody and make them stay in their homes, and we don't foresee that happening. So again, it's kind of like everybody else says, just relax, take a deep breath. I know that tensions are high and that your anxiety is high, but we really do have this manageable at this point and at this time, and we have been preparing for this, and although it's here and it's at some point Again, I said it yesterday, we live in a country that has the best medical personnel in the world, not just in a region or in the world. People come from all over. I want to reiterate that. They come from all over to get our medical help and our medical attention. So you should rest assured and be confident that they're coming up with a solution. Every day, I think they're going to make progress, and we're going to get through this. When we talk to you as public officials, we're only asking and requesting that you take these steps that we're asking you to take. If you have the ability to self-quarantine, and I shouldn't say that, what's the word that I'm looking for? Self-isolation. We're just asking you, limit your exposure to other people. The more you can do that, the more this has subsided for us as a community, and the quicker it goes away. And again, I said it yesterday, this is not like a storm where we have dangerous things on the street and power outages and the public has to evacuate. This is not the scenario. So we don't need to call for a curfew or take measures in that direction. What we need to do right now as a community is relax, help our neighbors. If you can stay home, I'm so proud of some of our businesses that are letting people work from home and do business from home. And that's why I encourage you, if you're going to venture out, what I'd like you to venture out and do is call in a take-home order for your family one night to these local businesses, and I'm talking about local restaurants and businesses that are doing just carry out right now. Do that to help out, because they're the ones that need the help financially. And venture out in those short trips, but avoid, again, that's why we've closed most of the public events and things that are going on, big events, sporting events. As much as we hate it and as much as we love our baseball and our football, those things are not available right now. So this is a good time to do family things and enjoy your family and relax. But as far as work, business is going forward. Our industries are going forward, but they've taken steps even with their employees to help limit exposure. So that's what the big picture is. Just limit your exposure. The less you're around people, then the less chances are that you're going to catch this virus and you're going to stay healthy. So as far as a law enforcement standpoint, we've seen no increases, no issues that need to be reported, but just stay safe out there, and there's not going to be any mass lockup in your house, and the National Guard's not coming in to take over. Everything's fine, and your public officials are very much on top of this, very much on the same page, and we're going to get through this just fine. If everybody will just take a deep breath and not look at Facebook rumors and things like that. Everybody wants to be in the know. Well, I promise you, this executive policy group, Dr. Kavanaugh and your medical professionals are in the know. We get updates constantly, and we are not going to hide anything from you. We are not going to hide one thing from our public. We're going to make sure that we tell you everything that we know as soon as we know it. Thank you.
All right, we have one more speaker, and then we'll take any questions if they weren't asked earlier, from the Lake Area Industrial Alliance, Jim Rock.
All right, thank you, Brian, and good morning, everyone. Of course, continuing to do everything I talked about yesterday. In addition to that, I've talked to a few plant managers and site managers yesterday afternoon, some others this morning. We're having more conversations this afternoon. And one thing that was brought to my attention I did not cover yesterday or talk about was that some sites that have big outages and turnarounds and maybe some small capital projects are looking at possibly postponing those to minimize the need for large groups of contractors in their sites at this time. Haven't made any decisions, and I'm not talking about large expansion projects being shut down. That's not the case, so please don't take it that way. It's more of turnarounds, normal routine outages. So if they can be postponed, they're looking at seriously looking at postponing them. Continuing to look at what's common terminology is ride-out crews. In other words, operators and specific maintenance people that might be able to stay in sites. Continuing to look for volunteers at the various sites for that, and also looking at bringing in some facilities that would accommodate operators and maintenance folks and supervisors if they had to stay inside a site for an extended period of time. There was a question yesterday about lunch tents and the crowding and things like that. I talked to a few of the plant managers about that, and some of them are staggering break times and lunch times so that to reduce the number of people that are in a tent at any given time to allow for maximum spacing in between individuals, like we have here today. Of course, in a lightning event, when you got to shelter everybody, there's no staggering in a case like that. And so I reminded all of them that they need to, when they're looking at shelters and the size of shelters, and need to look at how many contractors and employees they have in the site and make sure they can accommodate 100% of people at a safe distance inside those sites. One of the site managers has some contractors working in a area that's remote from the parking area, so they're having to bus these contractors from a parking lot to their site and to the work site. And what they told me they were doing is staggering seats in that bus. There's only one person in a row, and they're staggering rows and things like that to try to maximize opportunity for that spacing. And lastly, if there's any, not today or this week or this month, but for years and for years to come, anytime an employee, contractor, or direct employee, or service provider, or anybody feels like they're being put in an unsafe position or their health and safety may be in jeopardy, it's their responsibility as well as their right to bring that to the attention of their supervisors. And that's all I've got. Thank you.
I'm sorry, Jim, I just wanted to address with you, I had a fairly lengthy conversation last night with a contract worker who apparently drives his car to a parking lot and is then put on a bus. He claimed that they were packing him in there like sardines and that they felt extremely vulnerable, and I think part of their concern is maybe being fired if they complain too much or go public. Any additional advice on that?
Well, again, everybody has the right and responsibility to bring that up to their supervisor. And again, I'm giving the guidelines and reviewing the guidelines with all the site managers. If there's a specific case, a specific company or location or something like that, if I had that information, I could address it with the respective person in charge.
Thank you.
Okay. Thanks.
Okay, that concludes our list of speakers today for this session, but we do want to give an opportunity for any additional questions. Yes.
With regard to the case that we do now have in Calcasieu Parish, obviously people want any additional information they can get. Can you clarify whether it's actually in Lake Charles or some other part of Calcasieu Parish?
I cannot. I will ask if there's any clarification Dr. Kavanaugh can give. She would be the one to do it, so she will come up and
Well,
answer that
and while she's coming up, I know people are going to want to know whatever they can know about where this person was so that they can perhaps assess whether they came in contact with the person.
Okay.
So we, as a Department of Health, at this point in time, are going to follow up with the individual to make those determinations, but there are a lot of rules and laws that protect the privacy of patients and clinical information. So we are releasing information on a parish level, not on a city or town level. And you will see that that is the case for all the other parishes in Louisiana too, not just here.
Do you have any time frame as to when people in Calcasieu Parish may be able to get a few more details on that?
I do not have a time frame on that. I do know that a lot of that epidemiologic data, as more cases come available, it's easier to provide that information without compromising patient confidentiality. So you will see if you go to the LDH website that now there is a tab that they have added, because as a state we now have significantly higher number of cases, 347 this morning. And so as we have more cases, we will better be able to characterize the specific demographics of those cases. How many are in different age groups, where they, what parish they reside in, and eventually probably more information about the clinical presentation.
And I was wondering, as we see more cases, does it mean there are actually more people with the virus, or does it simply mean that more people have been tested?
probably some of both, because of course we know the virus spreads. So over time, we do expect numbers to go up. All of the measures that we put into place will protect it from going up as rapidly. But yeah, we also are ramping up testing capabilities. And so as we test more people, we expect to find more positives.
And one other thing I happen to know a lot of people who smoke. And since this is a respiratory virus, I was just wondering the extent to which it might help someone if they quit smoking before they catch it, if they ever catch it.
Right. Well, smoking is a huge factor when it comes to health and significantly impacts how long you live and how well you live, even without the virus, right? So it's always a good idea to quit smoking. And if the threat of the coronavirus will help people to do that, I think it's wonderful. Smoking is obviously a risk factor for chronic lung disease. So folks who have, say, COPD from smoking are going to be in a higher risk category for having a severe outcome. So I think it's a wonderful opportunity to quit smoking. And there are plenty of ways to help people do that.
But I mean, if you quit smoking, do you think perhaps it could improve your chances of pulling through if you catch it?
I don't know that we have any data that says that. However, in other sorts of respiratory conditions, yes, as you quit smoking, you recover quicker. So I would expect that quitting smoking would have a positive outcome, but we can't forget about the chronic damage that happens whenever you smoke either. So that history of smoking, even if you quit now, you still probably have some lung damage that could make you have a worse outcome. But quitting now will definitely be a good thing for your overall health, both for coronavirus and other conditions like cardiovascular disease as well. All right.
Just want to keep repeating the site, ldh.la.gov, which is a very helpful site the state has. And to go to one of Teresa's questions, it shows both the reported number of cases and reported number of tests, and that will be updated regularly. So we encourage everybody to go to that site for the latest information. Any other questions? Okay, that will conclude today's briefing. Again, the one tomorrow is at 2 p.m. here at the EOC. Thank you.